Right, good morning. I think we're live on Facebook. I think it says so there. And welcome once again to my glorious flat, which is getting tidier by the day. We've got an absolutely jam-packed 20 minutes show for you today. So I'm gonna move more or less straight on, but just to say there's a lot been happening in the world of tracking and tracing, and thinking about what happens as a result of the decisions we're taking now. So just to plug, first of all, Vix Lothian, who is our excellent parliamentary candidate on the Isle of Wight. That's where they're testing this week the new app. And if you want to find out what's happening on the island, following Vix is a really good idea. She is VixL, Vixl on Twitter. And Caroline Lucas has been looking at the impact that our decisions made today will not only determine how we get through the crisis, but also what might make irrevocable decisions about the future. So she's been publishing a report and she'll be doing ongoing work on this, looking at green steps to better. And that's really, really worth checking out. But yeah, onto the very, very full show we have today. First, we're looking at how the NHS is tackling coronavirus. And with more than 180 NHS and healthcare workers having died from coronavirus already, what the government needs to do more to support the NHS. For that, I'll be talking to Dr. Alex Armitage. He's a children's doctor working on the front line, and he's a Green Party member as well, and a brilliant parliamentary candidate. I'll be talking about the work that he's been doing. Alex appeared on Panorama on the 23rd of March, 6 weeks ago, appealing for more testing and more protective equipment.
Most importantly of all, though, we need to see a rapid and comprehensive rollout of testing in every single community so that we can focus our isolation and public health precautionary measures.
So that was Alex, and he'll be on very shortly. But we really want to hear more from you as part of the programme. So today we have another question for you. We want to know whether you would be happy to wear a non-medical mask or face covering for different activities. So if you go to menti.com, menti.com on your mobile, there's a question there. You can submit your answers instantly. The code this week to type in is 886940. That's 886940. And if you're watching on the screen, you can see it there at the top as well. We'll show your answers to that at the end of the show. I've been looking into what this might mean for me. I've been looking at the different patterns that you can find on the internet. I can highly recommend a couple of American sites. We've got the CDC, you've got very good advice on when you might want to wear one, how to care for a mask, and what the characteristics are of one that will actually protect you from droplets. Remember, it's not a medical mask, but it can have some protection. There's some patterns there. Also, the New York Times has got a very good printable pattern that you can do. Just a quick warning, they're both in inches. I had to find, to make my mask here, I had to find a conversion, and a ruler that actually measured inches was not to be found in my flat. But this is a mask that I've made. It didn't take very long. I've got a sewing machine, so that helped me. But yeah, this seems to be doing quite a good job so far. It's only half done. And I think I need some kind of pinch on my nose, but it's covering up pretty well. And I think these kinds of things may be useful if we're going to get back onto things like public transport, if we're going to be reopening shops and things like that. So do want to know what you think about wearing a mask like this, and I'll have some questions for Alex on that as well. But yeah, let's shift over now. Let's put Alex on my screen. Welcome into my sofa. So yeah, here he is. Hello, Alex. Nice to see you.
And we've got another guest here who might be joining you for some more stuff later.
Hello. Do you want to introduce yourself?
Hi, my name's Leander.
Hello there. Nice to see you. Right. Okay.
Anna normally goes to school, but he stayed off to come on your show and share some stuff later, Sian.
Fantastic. Well, we'll speak to you later on. We've got something fun planned. So Alex, you work for the NHS. Yeah. You're a children's emergency doctor. You've been doing lots of speaking out throughout this crisis. I showed you there in March. So can you start at the beginning? Can you tell us what was going on in terms of planning behind the scenes during January and February in the NHS?
Yeah, so we obviously knew about the coronavirus epidemic happening in China very early on, and we were following that with interest. And sort of towards the end of January and February, we realised that it was clear that this is, you know, a very infectious disease, and it was going to have a big effect on the UK. So what we were seeing during those times was that NHS trusts at the sort of, that sort of hospital level were working really, really hard. We did a few coronavirus sort of simulation events to look at the challenges of dealing with a very infectious disease. And we were also, you know, reconfiguring our services massively. We had a sort of heads up from Italy, so we were looking very much at how the Italians were reconfiguring their services, and we were doing sort of much the same kind of thing, so emptying out the hospital wards and creating sort of areas on the wards and in emergency departments for COVID patients and non-COVID patients. So we were really busy, and I think, unfortunately, on the other hand, the government level, they were really still in Brexit mode. And, you know, as late as the 3rd of February, Boris Johnson was talking about how the rest of the world was going crazy and Britain was going to be standing alone as this kind of free trade Superman, buying and selling to different countries, which was just totally the wrong kind of thing to be thinking. And it's, you know, been paid off with disastrous consequences, unfortunately.
You can totally see how those two attitudes sort of overlap and how they might have led to trouble. Do you think ministers at this point were listening enough to the scientists and epidemiologists, people who were talking about the different approaches we might take?
Yeah, I mean, again, it's like you kind of say, it depends on which scientists you listen to, because, you know, at that stage they were saying, oh, well, all the behavioural scientists are saying that we're not going to be able to sustain a lockdown, so we have to delay the lockdown as late as possible in order to sort of appease people's impatience, kind of thing. And again, they were completely off the mark, and they should have really been listening to the epidemiologists from the get-go, who were saying, you know, lockdown. And one of the, you know, chief WHO scientist said, and I remember this really vividly, he said, you know, it doesn't matter if you don't do it completely right, but you just have to act fast. And this is a guy who was sort of instrumental in dealing with the WHO response towards the Ebola outbreak. And he said, you know, you have to act with speed. And that was just the opposite of what we were doing. So that, yeah, the government was just really cherry picking advice from the scientists that they wanted to listen to in order to sort of meet their, you know, prioritization of the economy over people's lives, which was just a disaster.
So what was it like on the wards as things started to grow and the peak started to be approached? Obviously, we were all nervous the NHS would be completely overwhelmed.
Yeah, absolutely. And we were really nervous as well. It was really strange and eerie, really, because we were emptying out the wards, and we were really, you know, as the lockdown happened, people, you know, I work in A&E, and so people weren't coming into A&E at all because they were, you know, afraid of catching coronavirus. So, you know, normally we see a lot of the worried well, and they just weren't coming. So we were actually much less busy, but it felt really strange because we were all looking towards this kind of, you know, we in children's services, we all thought we were going to get redeployed to adult services. We were really scared because, you know, personally, I hadn't seen an adult for about a decade. So it was very much sort of like getting used to this kind of new way of thinking and acting, being prepared to be outside of our comfort zone. So
now, the situation that we're in now, we've got high demand still. What's the biggest challenge you're currently facing? Do you have the PPE kit you need? Have you got all the testing within the NHS that you were calling for back in 6 weeks ago? Is that sorted now?
Yeah, so I mean, in my hospital, we've always had the correct PPE that the Public Health England has recommended. But as we saw in the Panorama programme a couple of weeks ago, the PPE requirement was actually downgraded by the government for what now seem to have been political reasons. So, you know, in terms of the PPE that we're supposed to be wearing, which is the sort of plastic pinnies and surgical face masks, that's what we're using. And it is concerning that, you know, other countries have been using much more effective PPE than us. But really, I mean, the key is how you use it, and I think that's been missed a bit, because there's been so much anger at the government, and that's been, you know, appropriate anger at the government. They really messed up here. But personally, I feel pretty safe in my work. That's mainly because I'm working with children, and we know from evidence that children aren't really getting coronavirus badly, and tend not to be spreading it as well, which is something that we thought initially. So there are issues with PPE because, but they sort of tend to be at the higher level of government rather than affecting me and my colleagues. At the moment, again, it's very strange in A&E because we're not seeing all the sports injuries and the alcohol associated A&E admissions because, you know, like nightlife is shut down. But what we are seeing is a steady trickle of very sick, tend to be sort of older male patients coming in with really bad coronavirus. And so it depends on where you work. I mean, the NHS is set up for having a very busy A&E department and a sort of slightly less busy intensive care unit. But at the moment, the NHS is kind of being stretched in very unusual ways. So my colleagues who work in intensive care tend to be quite busy at the moment. But in A&E, it's very sort of strange because we feel sort of underworked at the moment. So I mean, we're using that time to sort of, you know, improve our processes and protocols, and also to think about how we can change in the future to deal with, you know, how A&E might be in the future. And we partly don't know how that is, but again, it's another chance to think about the climate emergency and how we're going to try and green our NHS services, which is a big deal. So we've got a bit of time to think about that.
Do you have access to testing? I know that you've got a bike on the wall there. You've got a tandem on the wall there by the looks of it. But there have been issues with the testing only being able to be available to people who drive, which obviously in London is potentially an issue. Have you noticed problems with that? Yeah,
so NHS staff will be able to get tested in our workplaces, but yeah, I mean, I haven't had any symptoms yet, thank goodness. But yeah, I think it's really difficult, and particularly in London, where, I mean, particularly in Hackney, where I live, only 30% of families actually own a car. So testing is really restrictive to people who have a car, who have the luxury of having a car, which is really ridiculous, I think. And might talk about it a bit later, but we had to think about how we could most effectively do testing. And
in the community,
and I think we've just kind of been overwhelmed with our sort of addiction to car culture, which I think is ridiculous.
Yeah, I mean, certainly the Royal College of Nursing have raised that nursing staff in non-hospital settings have had real problems accessing testing, and I think care workers as well. They're eligible, but they go in and they see that they can only access the car tests, and I think there's still real issues with that at the moment. But moving on to the community level testing, because you did come up, you've been thinking really hard about how to get community testing organised, and you had a great idea for essentially a Ghostbusters style team who would come around, give them a nice name so that they're not scary because they're coming around to test you, but who would come around, do your tests at home in proper PPE gear, and not make you have to travel to get your tests. Now that was a good idea. Now the government's moving towards realizing that to come out of lockdown we need effective testing and tracing regime in place, and a low infection rate, which is very, very big questions about whether we're at that rate of place yet. But their big phone app is what they're focused on. Do you think that's the right approach, and is there more that can be done on a community level?
Yeah, I think, you know, as with all of these challenges, not just coronavirus, we have to have a marriage of high tech and low tech solutions. And I think for the government to say, oh well, we can do all of this on the app is a problem. And we'll see what happens with the trial on the Isle of Wight. And I'm following Vixel on Twitter just to get her sort of first-hand feedback on that. But yeah, we need to have it's important to have these clever technological advances, but also it needs to have the people on the ground doing doing stuff. And I think it's a real travesty that we had this wonderful, 750,000 people in the UK signing up to volunteer for the NHS. And I think 150,000 of those were vetted out, but we've still got this kind of huge volunteer bank of 600,000 people, and most of them haven't been contacted and haven't had anything to do. And so there's this huge wasted opportunity for us to, really have a massive training scheme and get people on the ground in every community to carry out testing and contact tracing in collaboration with the app. And I think that's the answer, but we just haven't seen that leadership from the government to really get people involved. And I'm sure there'll be even more than 600,000 people who would volunteer to do the testing and contact tracing, which, by the way, should have started 6 weeks ago. We're really late on this, but better late than never.
Yeah. No, I know. I mean, I know that one of the key messages from the Green Party is, yes, we need an app. We need one that people are prepared to use, that they're prepared to download. And these are issues I've been exploring in London relating to, well, another app-based system that may be more or less compulsory is road pricing. If we're going to have smart road pricing, you need an app, but you need one that's not going to store all the data that you give it, that actually just keeps what it needs. And that's something that I've been trying to think about well in advance of bringing in road pricing. And yet the government seems to have just rolled out this app, and now they're dealing with the concerns around privacy. It's the wrong way around. But anyway, so let's move on to how we protect ourselves and get that infection rate really down. What's your view on whether people ought to be advised to wear homemade masks in public, and the effectiveness of those masks? What use are they?
Yeah, so I mean, this is obviously a new virus, but a few things we do know is that there seems to be this 2-week period when you have the virus, but you don't know you've got it, and you're potentially spreading it to many other people. And the sort of natural R number, or the infectivity number, is 3. So for an average coronavirus patient in the normal population, they will infect 3 other people in the course of their illness, and most of those people will be unknowingly infected. So we've got this situation where you, me, or anyone who doesn't feel symptoms could have coronavirus and could be spreading it. So whilst we haven't got really good evidence so far, because it's a new virus and we haven't done enough research yet, there's a really good sort of logic that people wearing face masks, or any kind of, it doesn't really matter if it's a sort of homemade face covering like a scarf or a hijab or anything like that. So wearing something that covers your face is probably a really, really effective way of stopping that asymptomatic spread, which is the spread of coronavirus when you don't know you've got it. There's a great article in the British Medical Journal just last week about this particular issue, and that recommended the use of these masks just on the precautionary principle that it probably works. I think your mask is brilliant. I am an NHS worker, and I've got access to masks at the hospital. I think yours is a lot more snazzy, and I really encourage people to, when you do have to go out and you do have to go to the supermarket, or if you're a health worker, to go on public transport, to wear a face covering, because I think it's likely to be really effective in getting that transmission number from 3 right down towards 0.
Great. Okay. Well, thank you so much, Alex. I won't say goodbye to you now, because our next bit of the programme is going to feature our other much smaller guest. Hello there. Right. So obviously, hello. Nice to see you. We are obviously, you're going to school some of the time, but a lot of children are not at school. And I'm not at school, and I would quite like to be doing a little bit of science today. So what have we got with us today, and what are we going to show each other?
We're going to show each other. So I'm going to show you how to stick a balloon on your head using static electricity, so that the balloon will defy gravity.
Go on then. Let's have a look. So I've got some balloons as well. And you've got a balloon. Should we see what we can do in terms of making these balloons static? Are you ready? Right, got your balloon? Okay, ready? Go. No, after a while, balloons become very. So what's your balloon gonna? Is your balloon picking up your hair now? Because mine are very much picking up my hair. What happens when it gets very, very static? What can you do with it then?
Then I'm going to put it on the ceiling. And
Go on then. Yay! So the balloon would want to fall from gravity, but what's keeping it up there?
Static electricity.
Yay! So you've wiped off a lot of the electrons from your balloon. Now it wants to stick to the wall. Now my balloons, I've been rubbing it on my head and cardigan for a while. I think these balloons may both be charged up. And let's see if I can get this experiment right. So if I hold this up now, I'm hoping that I've been doing it for long enough. In theory, these balloons, once I've charged them up enough, will
Should we try
next to each other.
Do one. And you do one.
Yeah, you do better than me. If they're both charged up, they should stick to my arm. They're still. Oh.
Maybe if you do. Maybe if you
No,
try.
mine are still
around.
totally willing to touch each other. That's not working at all. And I strongly suspect I've been making an enormous amount of noise rubbing balloons against my microphone as well.
How's it going? Ooh.
Oh, wait. Let's have a look at yours.
They're kind
Yeah.
of like spinning.
They are trying a little bit to stay away from each other there.
Yeah, they are. Let's try and turn it around.
Well, thank you so much. This is why I'm not a science teacher.
No, you're doing a good job, Sian. Keep on being the leader of the Green Party.
Yeah, thank you.
Really nice to see you.
Thank you, Alex. And we'll see you soon. Keep up the really good work. And thank you very, very much for coming on, both of you. It was really fun.
In a way, bye-bye.
Bye.
Bye. Thanks.
Bye. Yes, that'll be my career prospects reinforced for the time being. So yeah, that was fantastic. Thank you. So I want to go back now to find out what your answers were to my question earlier on. What do you think about wearing non-medical masks for some activities? So we're able to look at the screen here. Oh, looking at the question, here are the results. Right, so plenty of people are very happy to wear it on public transport. The next are going to the shops, picking up a subscription, picking up the kids from school. And then the lowest support is for going out for exercise, which actually, I mean, that makes some sense. I mean, we're waiting to see what the government's guidance is going to be. But in situations where you're not potentially anywhere near people in terms of contact, wearing a mask may just not be necessary. But I think we've all got to play the numbers game on this. If you're going to a place like a supermarket where a lot of people are in and out, where there's workers there, like on the buses who are there all day, there is, I think, some sense in asking people to protect themselves and to protect other people if they are potentially infected and not symptomatic yet. So there you go. Thank you very much. If you can, we'll be posting some links to where you can find the useful in inches mask templates. They're quite simple to do. I'm not saying it's not completely fiddly, but it was easy. I did it in about 10 minutes last night. Yeah, please keep letting us know what you think on Facebook, and please pass on the sign up link to join in with this every week. Next week we've got another fantastic guest and another topic to be discussing that's all to do with how we're coping with lockdown and the changes that we might need to make to keep more of us safe. So thank you very much, and we'll see you again next week. Thank you.